Hello everyone. I'm Dr. Asha Menon. I'm the Chief Clinical Principal for Certified McKenzie Clinic. Certified McKenzie Clinic is a global network in 28 countries. So Back Neck and Joints is the Certified McKenzie Clinic I run at two areas in Mumbai, which is Juhu and Mira Road. I have made this video for my patients for their self-help if they've had any episode of back pain at the time that we are in a lockdown due to the COVID pandemic. But if you've not been a patient in any of the certified McKenzie clinics worldwide, then too, this should give you some help of how you would not worsen your back pain. So let's go ahead, stay tuned. The first thing you've got to do when you've got a back pain is answer these questions. Where are your symptoms? Is it on the back? Is it on the buttocks? Is it on the thigh, the calf, the foot? Is it only on one side? That means, is it only on the right side or is it on the left side too? Or can it go, is it on both sides, right and the left? Or can it go from side to side? Let's say in the morning you've got right-sided back pain and thigh pain. Or by evening you get on the left side. So does it change sides? Does it include pins and needles, tingling, numbness? Is the pain only over the back or goes to the thigh or below knee? Now, once you've answered these questions to yourself, you got to also think of, is the pain all the time? Or even for 10 minutes, can you be off pain? That means, is the pain there 24 hours with you? Or even for 10 minutes in any particular position, posture, does the pain go away and become zero? Now, if it is there all the time, you need to change it to being off and on sometime. That means if it is at 24 hours with you, you need to change and come to a situation where you have pain coming and going. If you have pain which comes and goes, so you have about 10 times in a day you got pain which comes on, then you've got to aim that it's going off more often. That means if you have 10 times in a day the pain comes on, see to it that it comes on less frequently. Is that clear? Does that make sense with you? If you had this new back pain episode and you have not been treated earlier on for a situation where you've been a little off center, you got to check yourself in the mirror first. If you think that you're a little off center and your position or your posture is a little tilted, you would need help, and self-help may be a little difficult for you. So you see the person's shoulder is more on the right and the hips have come onto the left. So if you're somewhere like this, when you stand with your legs shoulder width apart, you would need help. So just message us and we'll see what best we can do. So what you need to do now, if you're not like the previous slide and self-help is possible for you, then you should aim at decreasing your overall symptoms. So if you've got 10 on 10 pain and all your activities have been disabled, you need to see to it that you get more functional, and from 10 on 10 pain you come down to 5 on 10, 4 on 10, ultimately to 0 on 10. And also aim that the pain which is most lower down goes away. So if you've got pain which is from the back to the foot, then see to it that the lower down pain, that is the foot and the calf, goes off first, and then or it begins to decrease. So it's got to be traveling upwards. Like if you're going to see this video, you see how it's going off up. That's exactly what you need. So the pain which was there all the way here has now gone away, and now it's only out here in the center. This is called centralization, which we have taught you while you've been our patients earlier. This is where the distal pain originating from the spine is progressively abolished in a distal to proximal direction. Okay, so what should not happen? If you've got just back pain, any activity, any position, any exercise you do should not bring your pain downwards. This is the opposite of centralization. If this is happening to you, you can be sure that you're worsening. So if you've not been my patient, this is one thing you can see. Curtail your activities, positions, postures. See to it that your pain doesn't travel downwards till the time that lockdown ceases and you're able to go for your sessions either to a certified McKenzie clinic or to wherever you prefer. If you've been one of my old patients, just check what has been the effect of the old exercise. Did you try to do the old exercise shown at the certified McKenzie clinic? Now always remember we would have given you, if you are one of those who have responded very quickly, we would have given you one exercise, which is a directional preference exercise, which takes hardly a minute or so to perform, and it's got to be done every 2 to 3 hours. So did you try doing that for 10 repetitions every 2 or 3 hours? And if you tried doing that, what was the result of it? Did your pain start traveling upwards? Did your pain reduce in intensity? Were you able to stand, sit, do your functions more better? If so, just continue the exercises. Let's look at interpreting the results of the exercise a little bit more carefully. So, what you do first is take what are your baseline symptoms. So, stand, legs shoulder width apart, see where your symptoms are. Let's say you've got pain on the back and you've got buttocks and you've got thigh pain. So, that's what's the pain you have before you start your exercise. Now, do 10 repetitions of your exercise. If during the exercise all your symptoms or the one which is most distal, let's say the thigh symptoms, while doing it they increase, or if during the exercises your symptoms, either all of them or the distal, decrease, or let's say there is no change to it, or if during the exercise all of the either all the symptoms or the one which is most distal, like in this case the thigh symptoms, they go away. But after the exercises, either all of them, all the symptoms, or the one which is most distal, they decrease or abolish or they remain unchanged. That is, you are the same as you started off with. Just continue with the exercises for a few more days. All right, just continue with that exercise. So as you continue with this old exercise, you need to stop the next slide position. So in the next slide, I'll show you some of the things that you need to stop. It's plain and simple. If you have a bad throat, then you take your medications, you might take hot gargles, but at the same time, you're going to stop taking ice creams. You're going to stop taking things that's going to make your throat worse. So if one exercise has got you better or has the potential to make you better over the next few days, you need to stop doing all those things which can worsen you. So over 93% of patients will get worse with any of these things. Either you do this exercise as a stretching exercise, or you decide to lie down like this and go off to sleep, or you sleep with pillows under your knee. These have to be stopped. Once again, 93% of patients will get worse with also these positions where you're sitting on the bed or on the couch with your legs long, watching the television, or you're sitting unsupported, prodding, when will the lockdown cease? Or you're into one of these awkward positions where you're looking at your mobile or working on a laptop. These have to be stopped because if the exercise is going to make you better, continuing doing these activities is going to make you worse, or the exercise will have no effect on you. Let's say, let's say if your symptoms are very high and you're unable to do the exercise, just try this for half an hour. Lie on your stomach. Half an hour, 1 hour, check your symptoms. If you think your symptoms have from the leg, it's now decreased or it's gone away, continue doing just lying down in this position every 2-3 hours for 10 or 15 minutes. And after 2 or 3 days, start doing your exercise and see what effect that has got. But if you are unable to get into this position, you need help. So you would need to message us. Let's see this by doing these self-help, your symptoms go away in 4 to 5 days or 1 week. Continue your exercise and the precautions for another 4 weeks. When you go back to full functions. But be slow on the gym and any high performance sports that you may have. But if your symptoms decrease but do not go away, take your appointments after the lockdown. So stay safe, stay indoors, stay pain free. Hope you are empowered. Please do like us on Facebook, Back Neck and Joints. At any time, please feel free to message us and we'll be at this end to help you out. Thank you so much.